Hi, my name is Shikha Patel Shah, and this is Anya Patel. Anya, do you consent to be recorded for cardiac exam video for my class NU650 for advanced health assessment class?
Yes.
All right, let's get started. So for cardiac exam, I've already done her blood pressure, which is normal, and now I'm actually going to have you lay down. So we're going to supine at 30-degree angle. We're going to check for jugular venous pressure and cardiac pulsation. I'm going to have you turn tilt a little bit. Okay, I am looking for the pulsation, and the JBP is 1 centimeter, that is normal. And now I am going to start by auscultating carotid arteries for any bruit. No bruits audible. I'm going to palpate your carotid arteries now, one at a time on each side, plus 2 carotid arteries. There is no asymmetry or no abnormality. So now I'm going to start by palpating the anterior chest wall. I am using my finger pads. I am looking for any lifts or heaves or any crepitus. I'm trying to feel for that and any tenderness. And now I'm going to palpate for thrills in the same area with the palm of my hand. Okay. No palpated. I am going to also palpate for point of maximal impulse, which is about 1 to 2 diameters. And now I am going to auscultate the anterior chest wall in all the 5 spaces. So first is aortic area on the second intercostal space on the right sternal border, and now in the left intercostal space, left sternal border, second intercostal space would be the pulmonic valve or pulmonic area. And then the Erb's point in the third intercostal space on the left sternal border. And now it will be the tricuspid valve in the fourth intercostal space, okay? And now the H-arms to lift your breast in the fifth intercostal space for mitral area. And I hear S1, S2, no murmurs. I'm going to repeat the same step, but now with the bell of the stethoscope. Initially it was a diaphragm. All right, I'm listening to that all 5 points. No murmurs audible. S1, S2 clearly audible. All right, now I am going to hear for mitral stenosis. I want you to turn on your left lateral decubitus position just a little bit. Perfect. Okay, no mitral stenosis audible. I'm going to have you sit up and lean forward. Exhale for me and hold your breath after expiration. Exhale. And no aortic regurgitation heard. And I am actually right now listening for that on the left sternal border. Okay? And now with this, we conclude our cardiac assessment. We are going to now start by peripheral vascular assessment. I am going to now palpate for your brachial arteries. There are +2 on each side for radial arteries, radial pulses. +2 on each side. I am going to perform a perfusion test. I'm going to have you make a fist, which is called Allen test. I'm going to block both radial and ulnar pulse. Can you open your fist? All right, so you see it's pale. I'm going to release radial pulse, and it is now pink flush. And now we're going to do the same thing. We're going to repeat on the other side. This one I'm going to try for ulnar. Okay, and now open your hands. Good. And close your fist again. All right, open your fist. All right, so there's perfusion is intact on each side in both ulnar and radial space. So now I'm going to have you lay back down for me. All right, and now I am going to palpate for femoral arteries. Okay, okay, +2. And now I'm going to have you flex your leg a little bit, your knees. And I am using both of my hands to, okay, +2 popliteal arteries. Okay. And now we're going to do dorsalis pedis, +2 dorsalis pedis, and now we are going to do posterior tibialis, and +2. Okay, so also at the same time, I am also inspecting for any difference in size or symmetry. The legs are symmetric. The color is, nice and pink. The feet are warm at touch. The temperature is even, hair is distributed evenly, no ulcerations, no discolorations, no varicosities or any varicose veins. Does it hurt when I touch? I'm touching for edema, and I do not see any pitting edema or any edema, no so much. With this, we conclude